My name's Martin Weinseer and I'm 52 years of age. It was really just a day like any other, the day I had my cardiac arrest.
Martin was a smoker and he went outside to have a cigarette and we heard a bang. Luckily our nephew found Martin had collapsed. He had performed CPR straight away. I called the ambulance. My brother-in-law had called Hatzolah.
I was given CPR, I was given defibrillation. It was the skills, firstly, of my nephew knowing CPR, Hatzolah, ambulance and fire service, and it was the equipment, the defibrillator, that saved my life.
My name's John Furstenberg. I'm 67 years old. I've had a heart condition since I turned 40. 3 years ago, when I was doing some work for my synagogue to move some chairs, I collapsed and had an arrhythmia. It was in front of one of the synagogues on Balaclava Road. And somebody was actually coming out and actually saw it happen and was able to call Hatzolah. They were there within a couple of minutes, and the next thing I remember was 3.5 days later I woke up out of an induced coma in the Alfred Hospital. Clinically I was dead, but the defibrillator being on the spot within that critical time period brought me back.
My name's Nikki Winston. It was first night Seder and I was having the Seder at my home. My in-laws have a couple who are very close to them. As he came towards me to give me a kiss good yontif, he leaned into my cheek and kept coming and didn't stop. And next thing, both of us were almost on the floor. I told my father to ring Hatzolah straight away. I felt for a pulse, there was no pulse. I flipped him on his back and I just started pumping his chest. And I felt like I was doing it for an hour, but I'm sure it was only a minute or two. And then next thing I knew, there were 3 Hatzolah responders around me. They did use a defibrillator on him. Then the ambulance guys came in and then they took him off to the Alfred. Certainly after this incident, he came back pretty well to where he was prior to Pesach of that evening, and he lived quite a few years after the event.
And landed, and we were at the baggage claim area there, picked up the baggage and bits and pieces, and then all of a sudden there was a commotion and there was a call, does anybody know CPR? And a lady whose name we found out afterwards was called Cherie Day, and she'd collapsed and they'd started CPR. And I sort of stood back for a second there and watched, and to the side I saw a defibrillator mounted on the wall. So I pulled the defib off the wall, ran back to Cherie, asked them to stop doing CPR for a minute to see where she's at, applied the pads to her, checked it, said that yes, that there was a rhythm there that needed to be shocked. Went through the first cycle, the first 3 shocks, which gave us no result at all. So then we recommenced CPR again. The next cycle, we actually got her back at the second shock and lost her again. And then at the third set of shocks, we got her back, and just as we got her back was when the fire brigade arrived and then followed by the ambulance service. There's little doubt in my mind that with the CPR going on that we wouldn't have had the successful outcome that we had, that we definitely needed the defibrillator, and I guess that I'm just lucky that I had the training and the knowledge to recognise what a defibrillator was and to see it there on the wall and to use it. Apparently it was the first time that a defibrillator from a public access place had been used and in a successful resuscitation.